Hello everybody, welcome back to my channel. My name is Deepika. In spite of having more infections, close to 22,000 in such a small yet expensive country like Singapore, how is the total number of deaths close to just 20 and how are the recovered cases close to 2,000? In this video, I'm going to be talking about the healthcare systems and strategies followed by the Singapore government to face the COVID-19 pandemic. Singapore has had an excellent medical service in the world, and almost 80% of the Singaporeans used to undergo treatment in the public medical services itself, and it's not as cheap as we think. Even the public medical facilities in Singapore are very expensive, and that too for people like expats. So this is the reason most of them used to go for medical insurance. Singapore's COVID-19 cases have risen sixfold since the start of this month or the mid of April due to the outbreaks that happened in crowded migrant worker dormitories, and the cases are now close to 22,000 there. So many people from various parts of the world used to work as low-wage workers in the country, mostly from Asia and India particularly. These people used to work in construction sites, cleanliness and maintenance, electricals and so on. So many factories have also been converted into dormitories for these kind of people to stay. At least 8 to 10 people stay in one room in the dormitories. This led to the easy spread of the virus among the wage workers. Singapore has had close to 11,000 acute care beds in both public and private care hospitals as of last year, and a little bit of the pressure on the public hospitals was taken away by the private hospitals by taking in the milder cases, and new premises were also created in short span of time to focus on the recovering patients. The Republic has had to expand its healthcare capacity due to a surge in the patient count brought about by the COVID-19, and new isolation wards were also created in short span of time to focus on the recovering and stable patients. This ensured that the acute care beds remained reserved for those who needed them the most. COVID-19 patients with mild symptoms and lower risk have been shifted to government-aided community centers like The Resort, NTUC, Singapore Expo, Changi Exhibition Center. These three are the community centers used as of now as isolation wards to absorb the patients. Such spaces like around 10,000 have been created by Singapore, and they are planning to expand it by June. About 3,000 healthcare professionals across various job groups and various age groups have responded to the government's call to help out the public sector and the community centers. The authorities have also looked for people from non-healthcare groups as well by giving them certain training packages to nurse the patients. For example, dentists have been deployed in swab testing teams as they have already been well trained in the use of PPEs, personal protective equipments. Such best utilization of the resources are made in Singapore to fight the COVID-19 cases. This is the reason why the healthcare system in Singapore is so good in treating the coronavirus patients and thus maintaining a very low death rate. With this note, let me end today's video. Thanks for watching. Have a great day. Bye-bye.